Welcome to Kellie's News You Can Use, a podcast dedicated to healthcare information. Welcome to Kellie's News You Can Use. July is UV Awareness Month, and I've asked Dr. Jillian Frieder, a board-certified dermatologist, to join us to talk about skin health. Welcome, Dr. Frieder.
Thanks for having me, Kelly. So excited to be here.
So I guess what we should really talk about first is you're joining our JKV family at the Center for Healthy Living.
Yes, super excited. We're still waiting on an official open date, but we're hearing rumors of a September 1st opening. So we're really crossing our fingers that we'll be ready to start seeing residents and patients by fall.
Fantastic. And they are waiting and excited. I'm getting emails, messages all the time asking your name. Is your office, in Boca? Can we go to them to see her then, before? And I'm telling them yes.
Yes.
So we're all so excited.
I've gotten to meet a few of the residents thus far, and everyone's been lovely, and I am excited to meet everyone else.
Fantastic. So can you give us a little background on your education and what you do in your office from a dermatology standpoint? And we'll start there.
Absolutely. Great. So I'm from Cleveland, Ohio originally. I could not wait to get out of the cold weather. So I went to University of Arizona for my undergraduate degree in physiology. I always knew I wanted to be pre-med, and then ended up I don't like cold weather yet. I had to go back to the Midwest to Detroit for medical school. So I did my medical schooling at Wayne State in Detroit. And then I ended up going to Dallas for my dermatology residency training, I was there for a total of 5 years because I did my dermatology residency along with a 2-year clinical research fellowship with a strong emphasis on psoriasis and eczema and chronic inflammatory skin conditions. So that was a wonderful experience, which I've, brought to my practice. And now here I am in sunny Boca Raton, Florida, with my original practice here in Boca, with my second up in Palm Beach Gardens, and then with our third opening up in Pompano. So it's been very exciting.
We're excited to have you. So when they talk about July is UV Awareness Month, can you tell us what is UV or ultraviolet? What is that?
So UV radiation, it's radiation that is emitted from the sun. So and UV is really divided up into 3 broad categories. You've got your UVA, your UVB, and your UVC. The vast majority of the UV radiation that's hitting the Earth's surface comes from the UVA radiation. That's about 95% of what we're affected by. And then the rest is made up of that UVB radiation. UVC radiation, those don't hit it doesn't penetrate Earth's atmosphere. So we're really worried about protecting our skin from the UVA and UVB, their wavelengths. So when we're looking for sun protection, we want to make sure that sun protection is covering all of those UV radiation wavelengths that are coming to us from the sun.
Okay. So let's say we're in sunny, South Florida. Our community is very active. Our residents are playing pickleball, they're swimming, they're walking, they're running. How often should you apply sunscreen when you're out?
Sure. So rule of thumb is typically to apply it every couple of hours. But that's going to change if you are doing water activities, exercises where you're heavily sweating. You want to make sure that you're going to be reapplying more frequently. And you definitely want to make sure you're using a water resistant sunscreen in those cases. But I would say good rule of thumb is 2 hours and then reapply. And people always ask, how much do you use? How much sunscreen should you use? So they say about an ounce, which is equivalent to like a shot glass. That's as much sunscreen as you would use for the full body. So typically you're talking about like a nickel size sunscreen for the face. Mm-hmm. But like you want it to be a nice, generous, full application.
Okay. And I have read, and you are the expert, as we age, and skin ages, are there other things that older adults are susceptible, being out in the sun, and skin damage and cancer? And what should some of our residents be aware of?
Absolutely. So there are a lot of skin changes that happen as we age. In particular, the skin definitely thins out. It becomes much more fragile. And that's also including fragility around the blood vessels that we have in our arms. And you'll see a lot of older patients in particular, they always complain about those bruises that you see on the arms, those really dark purple spots. So that's really attributed to the skin fragility that we start to experience, as we age. So we're losing collagen and elastic fibers. This, turns into lax skin. It causes the wrinkling. Of course, we get age spots from all that chronic sun damage over the years. As we get older, we lose skin hydration. So our skin becomes drier. So it's really important that we are hydrating the skin. And people are always like, oh, does that mean drinking more water? Yeah, drink water, but it also means hydrating with moisturizer. So it's really important to be moisturizing daily to protect aging skin. Best time to do it is right out of the shower. We know as we get older, wound healing is slower. So a lot of people will comment about that. And then, with the age, skin cancers are, of course, a big thing that we worry about, because these skin cancers come from, it's all chronic cumulative sun damage that we've had since we were little. So this UV radiation, every time we're exposed to it, it creates tiny little genetic mutations. And, individually, these mutations don't amount to anything. But over time, the more mutations that we accumulate with constant sun exposure, that is what turns into why we start getting these skin cancers. So, of course, it's important to have your annual skin checks to stay on top of that.
Wonderful. So we're talking about all of this skin protection with sunscreen, but we need sun to produce vitamin D. So Can you explain that and what we need to be concerned about, and how much sun do we need, and will we get it with the sunscreen on?
I get asked this constantly, and I think it's a really important question, because the vast majority of us do have some degree of vitamin deficiency. And it's true, the 95% of vitamin D that we get does come from the sun, and the rest of it comes from, supplements and diet. So I did a little bit of research on this because I was actually curious myself. And the truth is, there really aren't any objective studies that have evaluated this. And the data that we do have in the literature does not show that wearing sunscreen daily reduces or increases your risk of vitamin D deficiency. We are still getting the vitamin D that we need despite wearing sunscreen all day, every day. And the truth is, it's probably because, as good as sunscreen is, it doesn't block out 100% of the sun. So you are still getting plenty of UV absorption, especially here in sunny Florida, where the sun is just so strong all day, all year round. So I think people can be reassured that you can safely wear your sunscreen. You don't have to worry about going, vitamin D deficient. Of course, if you are deficient, that's important to speak with your doctor about supplements. So generally, adults over the age of 70, they recommend, I think, 800, international units daily of vitamin D. If you're more deficient, then higher doses. But you really should be able to get adequate vitamin D from careful sun exposure with sunscreen and diet and supplements.
So if you are vitamin D deficient, are there some signs that people can be aware of, or is it kind of like that silent?
I would say most of the symptoms are pretty non-specific. So people might complain of fatigue, you can get muscle pain, joint aches, bone pain. So there's nothing really that you can hang your hat on that I would say, oh, if you're experiencing this, you probably have a vitamin D deficiency. So it's good to just get checked annually.
And should older adults or people with any type of predisposed, maybe history in their family of skin cancer, should they see the dermatologist more than once a year?
Good question. The truth is, there are no standard guidelines on how frequently an individual should be screened for skin cancer. I think, they say get checked once in your lifetime. Typically, especially living in Florida, we recommend an annual skin check for my patients who frequently get skin cancers. We keep a closer eye on them. So we have them come in more frequently, every 6 months, every 4 months. And then with family history, if there's a strong family history, particularly of melanoma, we might consider screening a patient more regularly. But I would say good rule of thumb is once a year, make sure you see your dermatologist.
Okay, great. So I heard this way, I think I was probably in college, and I don't know if it's true, but I'm going to ask you because you're here, and I think it's a great opportunity, that people with lighter eyes are at higher risk, and it's not necessarily how dark your skin is, but how light your eyes are. Is that true?
It is true. Yeah, we say people with lighter eyes or lighter complexion or hair type, you are at a higher predisposition for skin cancers because it's all about the melanin content. So melanin is the pigment that we produce, and it is what is protective of the UV radiation. So people who have darker complexion, darker hair, darker eyes, they have more of that melanin, which is protective of that, sun damage. So we know people who have lighter eyes, they tend to burn more easily. And so there is definitely truth to that statement.
Okay. So, cause I have light eyes, but I have the dark hair and the dark skin, but I have some risk there because of the light eyes.
Exactly.
Gotcha. Yes. And a few other interesting things as we age and our skin starts to break down a little bit. Are there certain things, we're told moles and stuff is something that you can let an older individual, things that they need to look for maybe a little bit more vigilantly?
Sure. So typically we follow the A, B, C, D, E's of melanoma. So A, you're looking for asymmetry. B, border, any border irregularity. C, multiple colors. You want your moles to have just one homogeneous color. We look for diameter. Typically we say lesions over the size, larger than the size of a pencil eraser. That could be suspicious. D, duckling or ugly duckling. Which mole stands out from all the other moles? Which one just doesn't fit in with the rest? And then E for evolving. Moles should be stable. When you're an adult, your mole should be very stable. So any changes in size and shape, that should definitely be brought to the attention of your dermatologist. So those are, I would say, just easy things for people to look out for on their own skin and just to be aware of. And then also things that are non-healing. So we always think about melanoma, but truly the most common skin cancers are your basal cells and squamous cells. And these tend to present as people often say, oh, I thought I had a pimple and it just wasn't going away, or I have a sore that just is not healing. These are other signs to look out for skin cancers.
Very helpful. So we're going to go back to the Center for Healthy Living. We're hoping September. What can you give us an idea of your general hours?
Goal is to ultimately be open 5 days a week. I think starting off will probably be open 4 days a week, 8:30 to 4:30. I know when I spoke with the residents last time, they were very they wanted to know who the providers were going to be. And I'm going to be there. And I know there was a lot of emphasis on having MDs and, actual dermatologists and not just PAs. So I'm onboarding another dermatologist. So we're in the process of bringing on another dermatologist. And so I want the residents to know that they're going to be seen by doctors. So they can feel very good about that.
That's exciting. And you will be in suite 200, correct?
I don't know. Am I?
Yeah.
Okay. Suite 200. Now I know. Good.
So, this is so exciting. And I know, not only are the residents, but a lot of the employees are looking forward to you joining the JKB family here. I thank you so much for your time. And I hope we can connect soon. Have a wonderful summer and we will talk shortly.
Thanks so much. You be well.